Welcome to Corporate Insights webinar on our 2025 Commercial Health Plan Experience Benchmark, which published in July. My name is Stephanie Chan, and I'm the Healthcare Team's Research Manager here at Corporate Insight. Before we dive in, I want to highlight a clear opportunity. Our research shows that 83% of health insurers earn a lower mobile app score than their website score in our benchmarks. This is highlighted by the overall average scores, which for the mobile benchmark is 63 compared to 70 for web. With this gap in mind, our research also shows that members are much more active on their insurer's mobile app than website. In today's presentation, we'll examine this parity gap between web and mobile experiences and think about how health insurers can transform their approach to bridging this gap between mobile usage and performance. Here's the agenda for today's session. My colleague Tess Martin and I will walk you through a brief introduction to Corporate Insight, and then we'll get started with our benchmark methodology. We'll take a look at how top firms are performing in both the web and mobile benchmark, along with interesting trends that we are seeing in this year's data, as well as compared to last year's benchmark. Then we'll dive into two categories: coverage and health information on web, and profile and settings on mobile. We'll wrap up with key takeaways and save time at the end for Q&A. To introduce Corporate Insight, our firm has been an industry leader since 1992, researching digital experiences for as long as they've been available. We serve leading healthcare and financial service firms where we provide the competitive intelligence and UX research they need to build best-in-class customer experiences. What makes us unique is our ability to combine customer insights with industry expertise. We analyze the user experiences of more than 200 institutions, delivering recommendations that help you make data-driven decisions. Our research shows what it's like to not only be your customer, but also your competitors' customers, helping you meaningfully improve your experience with concrete recommendations and gain a competitive advantage within your industry. Our services span 5 key areas. First, our monitor research, which tracks 22 industries and provides timely updates on competitor changes, detailed capability matrices, best practice reports, and analyst support. Second, our experience benchmarks, which we are talking about today. These provide comprehensive annual studies with quantitative scorecards and strategic recommendations. We also offer 3 customized services: custom research projects, UX research, and quantitative research, all designed to provide tailored insights that drive business growth. Our methodology is unique. We are your customer. What this means is that what the everyday consumer sees when they access a competitor website or mobile app and then log in, that's what we evaluate. Our teams review digital experiences both pre and post login, which we refer to as the public site versus the member site. So we review both publicly available information, like quote tools and plan product pages, as well as behind the login authenticated experiences, like claim listings and coverage and benefit interfaces. In today's presentation, we'll be focused on the latter, the member experience. Across Corporate Insight in total, we have access to over 700 live accounts from over 200 firms. Our analysts review user journeys on these firms' websites and mobile apps more than 750,000 times a year. We are constantly in these websites and mobile apps, day in and day out, evaluating different features and keeping track of any experience changes. Now let's move on to discussing our benchmark. This study assesses the member experience for health insurers on websites and mobile apps. We then take that data and create reports that help our clients understand where they rank in the industry and where they may have competitive advantages or opportunities to improve. These reports cover 24 leading insurers and touch on their strengths and weaknesses, highlight the leaders in each category, and outline key findings. We publish 1 report for the website experience and 1 for mobile apps. And I want to emphasize that what we are going to present today is just a slice of what is available in the full reports. Today, we have about 30 slides of findings to talk about. In contrast, the full web and mobile reports are over 100 slides each. So if you like what you see, there's a whole lot more of where that came from. We also offer fully customizable versions of these benchmark reports. But today, I'll be going over findings from our 2025 syndicated version, which is available for purchase now. So now let's dive into the benchmark research methodology, which is to say, how did we do this research? Underlying the health plan experience benchmark is a framework made up of categories at the top level, and there are 8 of those. Categories are themselves made up of subcategories, and there are 31 of those. Finally, subcategories are made up of what we call attributes, and there are more than 120 attributes each for web and mobile. I and the analysts on my team assign one of 4 grades: excellent, good, fair, or poor. And each grade's criteria is written as objectively as possible, such that any given analyst at Corporate Insight would assign the same grade for a given firm. And we go through this rigorous grading process for all 24 firms across every attribute, in every category, and on both platforms. Once all of this grading is done, we can generate scores and ranks for each category and at the overall level for both web and mobile platforms. Scores are in a simple, easy to understand format of 0 to 100. We bucket firms using the table you see on the right: leading, achieving, effective, and trailing. And for the custom version of this research, we also provide subcategory level ranks and scores, as well as attribute level grades. So since we've been doing this for a few years now, we can tease out trends in performance over time, and we can show you where insurers are investing their resources to improve their websites and mobile apps year over year. Today's presentation will also include snippets of the other element that underlies this research, which is our annual consumer survey. More than 1,500 respondents helped us understand which web and mobile features are most important and most used in order to generate our weighting system. This slide and the next show our benchmark framework. So the categories are at the top, such as coverage and health information, claims, digital care tools, and so on. You can see the subcategories below in bold, and then the attributes are listed under each one. Here is our coverage set. So as I mentioned, we evaluate the digital experiences of 24 leading health insurers. We also introduced 3 firms to our coverage set this year: Blue Shield of California, BCBS of Michigan, and Surest. I mentioned our annual consumer survey earlier, and that's because it is a key element of our benchmark. In our survey, we asked insurance members which features they believe to be most important and which features they use the most. When respondents call a feature very or extremely important, we take note of that. We also take note when users tell us which features they have used most in the past 6 months. We synthesize these responses to set the importance weightings of the benchmark framework at the category, subcategory, and attribute levels. You can see the category level weights in the charts to the right, which are similar but not exactly the same across web and mobile. But for both, we see that claims and coverage and health information are by far the most important at a 20% weighting. And now we'll move on to findings from our 2025 study, starting with web. Our coverage set firms earn an average score of 70 in the website benchmark, an increase of 3 points from our 2024 benchmark. Only 3 firms place in the leading tier. That's a score of 80 and above. Most of the firms land in the achieving class, which is a score of 60 to 79. And we have 3 more firms in effective, which is a score of 40 to 59. A positive note for the industry is that no firm lands in the trailing class, which is a score below 40. That suggests that basic digital functionality has become table stakes across the industry, and all firms are meeting fundamental standards for their online experience. In first place this year, we have Aetna with a score of 85. This is impressively a 7-point score jump from how it performed last year. And second, we have United Healthcare, which maintains its score of 82 year over year. And in third, we have Care First, which just made the leading class with a score of 80, thanks to a 5-point score jump from last year. Now let's take a closer look at each of these top performers and what led to them taking these top 3 positions. So starting with Aetna, since the 2024 benchmark, they added an integrated virtual assistant and live chat tool while removing their legacy site. This contributed significantly to the score increase, and the new chat feature allowed it to place first in the support category. Aetna also takes second in the more heavily weighted categories of claims, design and navigation, and digital care tools, which helps pull its score up. Aetna also earned higher scores in every category this year except for health and wellness resources, where it maintained its high score of 89. United Healthcare did roll out site enhancements in the last year, but they were not significant enough to increase the firm's overall score. And so it maintains its score of 82 in this year's benchmark. UHC places first in claims, standing out for having both online claim submission and payment platforms. It also houses the widest range of claim management features in our coverage set. And other impressive ranks for the firm include third place in design and navigation, digital care tools, and support. CareFirst places third, and since our last benchmark, it amplified claim details and filter options, introduced additional EOB details, and improved its cost estimator. This lended to its first place finish in digital care tools, as it offers the robust Sapphire care and cost tool and also various telehealth options. And another standout finish for the firm is second in prescriptions and pharmacy, thanks to the CareMark platform that it employs. Now here let's take a look at some other score jumps that we see in our coverage set. In fact, all firms in our coverage set either maintain their web score or experience a score jump year over year, revealing quite steady industry progress in digital capabilities over time. This demonstrates continued investment and shows us that it's not enough to simply maintain digital platforms the way they are. Continuous change is required to stay up to par with competitors. Florida Blue has a 10-point score jump that is attributed to the availability of a virtual assistant as well as teledoc access. The firm enhanced its main menu and homepage while adding point earning and redemption options to its rewards program. So overall, it boosted its performance across multiple categories. BCBS of Massachusetts score went up by 7 points, with some changes being improved homepage imagery, the addition of an alert center, and now allowing members to add demographic inputs on the site. And we also see a 6-point score jump for Highmark, which introduced personal health records and a helpful glossary for insurance terms. Next, we wanted to spotlight some innovative website features that we observed in our coverage set. In general, consumer expectations continue to grow, and it is crucial for insurers to position themselves as not just a website that users go to when they need to check their claims or find an in-network doctor. And we see that from the medical support offered by Cigna and Highmark. Cigna's dual-purpose chat allows members to connect with a customer service representative or with a nurse to receive medical help. Highmark offers a symptom checker in the form of a chatbot, which can generate different care options based on the inputted symptoms. Firms are also taking steps to reduce friction in the digital journey. Aetna and Oscar are the only two firms with passwordless login, a feature that is commonly seen in industries outside of insurance. Blue Shield of California stands out for offering its member site in Spanish, Chinese, and Vietnamese, reflecting its diverse membership base. And lastly, member engagement. Anthem BCBS's provider locator tool recommends several provider specialties and procedures, and members can give feedback on whether they find these suggestions relevant. Independence Blue Cross also offers a strong in-house rewards program, along with health challenges and health trackers that transforms the site into an interactive experience. And tying in our monitor research, our Pace of Change reports track the volume and type of changes that health insurers make to both their public and member sites. In our most recent report, United Healthcare, BCBS of Illinois, and Aetna were the most active firms. They made 41, 38, and 37 changes respectively. These active firms also rank among the benchmark's top performers. As we already discussed, Aetna places first and United Healthcare is in second. BCBS of Illinois is also not far behind in 8th place. Conversely, firms that publish the fewest changes, Tufts Health Plan, Emblem Health, and Select Health, rank near the bottom of our benchmark. What does this show us? Well, it means that the most active health plans are offering stronger user experiences. And this makes continuous platform innovation essential to maintaining competitive digital performance. Regular updates signal commitment to the member journey and drive performance gains as seen in our benchmarking. Now I'm going to pass it off to Tess, who will walk you through the rest of this presentation, starting with findings from our mobile benchmark. And as a reminder, feel free to enter your questions in the chat and we will address them at the end later during Q&A.
Thanks, Stephanie. Now we are going to dive into our mobile findings, starting with the overall mobile rankings. This year, the industry average sits at 63, which represents a 6-point increase since our 2024 experience benchmark. Looking at the 24 firms covered in this report, we see that 21 firms fall into the achieving category, scoring between a 60 and 79. However, it's notable that no firm reached the leading tier with a score of 80 or above. This suggests significant room for innovation and improvement across the industry. 2 firms landed in the effective range of 40 to 59, and 1 firm trails below 40. The concentration of scores in the mid-60s to high 70s tells us that while firms are making progress, there's still substantial opportunity to differentiate the mobile experience and implement improvements. Anthem BCBS takes first place this year with a score of 79, maintaining their top position from last year with a 2-point improvement on their 2024 score. United Healthcare follows in second with 76 points, also up 2 points from 2024. And Aetna rounds out our top 3 with 75 points, a remarkable 9-point jump from the previous year. Now we'll take a closer look at our top mobile performers, beginning with Anthem BCBS. Anthem retained its top position through enhancements to multiple categories. Since our 2024 benchmark, they've expanded prior authorization details, improved EOB findability, and updated their cost estimator tool, and added a nurse line. All features that directly address member pain points. Anthem earned first place in the digital care tools category, thanks to their integrated in-house provider locator and cost estimator tools. They also secured first place in support, powered by a robust message center and their Sydney chat assistant. In the 2 most heavily weighted categories, claims and coverage and health information, Anthem placed second, demonstrating strong performance in the features members use most frequently. United Healthcare continues to hold strong in second place with a 2-point increase. Key enhancements since 2024 include improved medication list and drug cost tool results, enhanced chat capabilities, and updated app navigation, all focused on streamlining the member experience. United Healthcare's best categorical performance came in digital care tools, where they placed second, followed by third in claims. These are critical categories that are widely used by members and drive engagement. Aetna's 9-point score jump is one of the most dramatic improvements we observed this year, moving them into third place with a score of 75. This remarkable increase was driven by 3 major additions: a chat tool, a secure message center, and a comprehensive in-app search functionality. These are important self-servicing support features that significantly reduced member friction. Aetna performed best in health and wellness resources, placing third, followed by 4th place finishes in both design and navigation and support categories. Beyond our top 3, several other firms made significant progress this year. Florida Blue jumped 14 points with a virtual assistant and planned videos for improved member education. They also provided seamless single sign-on access to Teladoc, Amazon Pharmacy, and Prime Therapeutics, reducing the friction of navigating between platforms. Mass General Brigham Health Plan increased its score by 8 points through major security and integration enhancements. They implemented 2-factor authentication, added seamless access to their patient portal, which houses personal health records and virtual urgent care, and introduced care team management functionality, along with the ability to edit contact information directly in the app. Now I'm going to walk through some innovative mobile features that help some competitors stand out in certain areas. Some firms made strides in creating seamless journeys to improve the member experience. United Healthcare's claim submission tool uses intelligent document scanning to read uploaded receipts and pre-fill form inputs. This saves members significant time and reduces errors. Meanwhile, Highmark BCBS integrated their chat tool directly into the Express Scripts platform, creating a seamless connection between member, insurer, and PBM. Other firms focused on implementing design choices that prioritize members' unique needs and preferences. Oscar Health features action items and For You sections prominently on their home screen, proactively guiding members to important tasks. Aetna introduced a dark mode option, a small but unique accessibility feature. And United Healthcare made ID cards available offline and even pre-login, ensuring members can access this critical information anywhere, even without connectivity. These innovations demonstrate how thoughtful design and integration can dramatically improve the member experience. Interestingly, our consumer survey found that members log in more often to mobile apps than websites, but mobile apps consistently score lower than their website counterparts. The largest disparities appear in health and wellness resources with an 18-point gap. While all but one firm offer health and wellness resources of any sort on the desktop site, a considerable number of 29% choose to forgo these resources on apps. Support has the second largest disparity with an 11-point difference. Digital care tools, prescription and pharmacy, and coverage and health information all show gaps of 6 to 10 points. These differences may be attributed to the lack of real estate on mobile apps compared to websites, leading to limited offerings and capabilities. This creates a significant disconnect. Members are increasingly mobile first, but the experiences being delivered on mobile lag substantially behind web capabilities. This represents an opportunity. Firms that close this gap can gain significant competitive advantage in member satisfaction. So this scatter plot reveals another important insight about the relationship between functionality and usability. Our usability scores are generated by combining ease of use subcategory scores with design and navigation category scores, while functionality incorporates all other framework attributes. The industry averages cluster around 71 for website functionality and 68 for usability, with mobile apps averaging 64 for functionality and 65 for usability. Websites have higher average functionality score than usability score, suggesting that firms are adding features but may not be optimizing the user experience around those features. Feature-rich platforms would benefit from additional attention to user-centered design elements like intuitive navigation, clear information architecture, and streamlined workflows. Notably, no mobile app scores above 80 on both dimensions, while Aetna is the only website to cross that threshold. This reinforces the idea that there's significant room for firms to differentiate themselves through superior mobile experiences that balance robust functionality with excellent usability. Zooming in on our leaders, we see consistently higher scores for functionality over usability, but the gaps do vary. United Healthcare shows the largest spread at 9 points for both their website and mobile app. Aetna's website demonstrates the smallest gap at just 3 points, making it the most balanced, high-performing experience. For mobile, Anthem BCBS has a 7-point gap. This pattern suggests a common industry challenge. Firms are successfully building feature-rich platforms, but struggling to make these features easily discoverable and usable. The firms that can close this usability gap while maintaining functionality strength will likely see the highest member satisfaction and engagement. Notably, our customer survey identified the 4 top actions members perform on their insurance accounts. These were checking claims, viewing coverage and benefits, checking plan usage, and searching for a doctor. However, subcategory scores for these critical functions average only in the 70s. To put this in perspective, the core reasons why members log in are not delivering stellar experiences. This misalignment leads directly to user frustration, unmet expectations, and increased call center volume, all costly outcomes for plans. When members can't easily accomplish their primary goals through self-service channels, everyone loses. Members experience friction, plans incur higher service costs, and member satisfaction suffers. Improving these core workflows should be a top priority for digital experience teams. Now we're going to preview some evaluation categories from the benchmark in detail, starting with coverage and health information. This category represents 20% of both website and mobile scores, making it one of the most heavily weighted areas we assess. It encompasses 4 key subcategories: plan coverage and benefits, plan usage, member ID card, and personal health records. We also conduct an ease of use assessment with real-world journey, testing for benefit searches and ID card access. Our survey findings show just how critical this category is. 57% of mobile respondents checked coverage and cost details in the last 6 months. 53% checked their plan usage, and 30% of web respondents viewed or requested their ID card. These are high-frequency, high-important tasks that directly impact member satisfaction. For coverage and health information specifically, the web rankings look quite strong. Horizon Blue leads with an impressive score of 96, up 9 points from 2024, representing truly exceptional performance. Anthem BCBS follows in second with 88 points, up 1 point. And Wellmark rounds up the top 3 with a score of 86, up 2 points from last year. The industry average for this category sits at 73, up 4 points year over year. And the distribution here is healthy. This suggests that firms have made coverage and health information a priority, likely because it's so fundamental to member needs. However, the 73 industry average still leaves room for improvement, and the 9 leaders demonstrate that excellence here is achievable. Let me now share a best practice example from Independence Blue Cross. Their ID card implementation earns recognition for detailed card information, comprehensive display options, and robust functionality. First, they display the card information in multiple formats, as embedded front and back card images and as text on the page, ensuring accessibility and usability across different scenarios. For member education, they provide an interactive infographic showing where specific information appears on the card, paired with a corresponding glossary that defines each element. This is particularly helpful for members new to health insurance or those unfamiliar with insurance terminology. Finally, the functionality is comprehensive. Members can print, email, fax, download, or order a physical ID card. They can also enlarge and rotate the embedded card for better visibility. This multimodal approach ensures members can access and use their ID card information in whatever format best suits their immediate needs, whether they're at a pharmacy, on a call with a provider, or submitting documentation. So now let's take a look at another category, profile and settings. This category represents 7.5% of web scores and 10% of mobile scores, and it evaluates 3 main subcategories: profile, security, and communications. Our ease of use assessments for this category tests the email address update journey. Survey findings highlight the importance of this category. 81% of mobile respondents indicated security settings were very important or extremely important, the highest importance rating we saw for any feature. 25% of web respondents changed their username or password in the last 6 months, and 18% opted into multi-factor authentication. For profile and settings on the mobile side, we do see lower scores overall compared to coverage and health information. Florida Blue leads with 82 points, an impressive 17-point jump from 2024. Highmark BCBS ties for second with 74 points, up 16 points. And Kaiser Permanente also scores 74, up 2 points. The industry average is just 58, though it did increase by 10 points year over year. The distribution shows only 1 firm in the leading tier, 12 firms achieving, 10 firms effective, and 1 firm trailing below 40. These lower scores suggest that profile and settings functionality hasn't received the same investment as member-facing features like claims and coverage. However, the substantial score jumps from Florida Blue and Highmark BCBS, up 17 and 16 points respectively, demonstrate that focused attention on this category can yield significant improvements quickly. Given members' stated importance of security settings, this represents a key opportunity area for many plans. Florida Blue's profile implementation showcases comprehensive member control. Members can edit a wide variety of information: email address, multiple phone numbers, and extensive demographic data, including preferred language, disability status, and highest education level. This level of detail enables better personalization and accessibility. The Care Team Management feature allows users to view assigned providers for each of their family members on the plan and add or remove providers as needed, essential for coordinating care. 2 particular notable features. First, members can add caregivers to their account, facilitating family support for elderly members or those needing assistance managing their care. Second, they can provide information about secondary insurance plans, which is critical for accurate claims processing and coordination of benefits. These screens demonstrate how thoughtful profile design can anticipate real-world complexity. Multi-generational families, caregiving scenarios, and coordination between multiple payers, rather than assuming every member manages only their own individual coverage. Now we're going to switch to looking ahead, and I'm going to summarize some key takeaways from this year's benchmark. First, though websites earn higher scores than mobile apps, the moderate industry averages for both platforms, 70 for web and 63 for mobile, signify substantial untapped potential for digital innovations. Second, users increasingly expect health plans to match the digital sophistication they experience elsewhere online, in financial services, e-commerce, travel booking, streaming platforms, and rideshare apps. The bar for good enough is constantly rising. Third, digital activity directly influences platform performance. The firms making continuous investments in their digital experiences are pulling away from competitors. This makes ongoing platform innovation essential for maintaining competitiveness, not a one-time project, but an ongoing commitment. Finally, the most critical finding: the core reasons why members sign in, claims, coverage, spending, and provider search, are delivering subpar experiences with subcategory scores averaging in the 70s. Until plans address these fundamental use cases, they're leaving their most important members frustrated and maybe driving unnecessary service costs. For organizations considering deeper engagement with our benchmark research, let me outline the strategic questions we can help you answer. What is driving performance gaps for us on both website and mobile? How far behind is our mobile experience from the website? Which competitor innovations should we adapt to reduce member friction? Where do competitors score 10 or more points higher than us, and what member experience advantages does that create? What are our key priorities to significantly boost our score and rank? The benchmark isn't just about knowing where you rank, it's also about understanding why and having a clear path forward. I will now pass it back to Stephanie for the Q&A portion of this session.
Great. So we're just going to wrap up today's webinar answering some questions. One was, when were these sites and apps graded? So we conducted our evaluation earlier this year in the spring, as well as early summer, and then these reports were published in July. Another question we have is, does this cover Medicare or Medicaid experiences? So this is our commercial health plan experience benchmark. So we are evaluating the commercial experience. It does not cover Medicare or Medicaid, but Corporate Insight does offer Medicare Monitor, where we are tracking the experiences of Medicare Advantage, Medicare Supplement, and also PDP plans. Another question we have is, are you grading PBM sites in the prescriptions category? So we do look at both in-house and third-party prescription capabilities, as long as the PBM platform is findable via single sign-on or SSO. And then for mobile, we are also assessing it as long as it does not open a separate mobile app that requires users to download. And then one last question we have here, does the benchmark include patient sentiments? So our annual consumer survey is meant to look at what features users find most important and which ones they are using the most. But we are not including their sentiments in our benchmark. That is an objective evaluation we are conducting, and the patient information we are getting from our survey is meant to tie into our weighting framework instead. So it seems like that is all the questions we have here for today. Thank you again for attending today's webinar. You can find our contact information here in this slide. Please do not hesitate to reach out to us if you have any questions about the presentation, the benchmark, or Corporate Insight services in general. Thank you, and have a great rest of your day.